好，各位同事，歡迎大家嚟到我哋 Child Scene Talk。今日2024年10月27日，咁呢就相信大家都有一個好溫暖、好愉快嘅聖誕假期。咁呢就啲同事問我，哇，咁早開工嘅咁就其實就唔係真係開工嘅，因為其實呢個 talk 呢就係預早錄影咗先嘅。咁事緣呢，又因為今日嘅講者 Candy 呢，就其實唔喺香港嘅，佢呢就喺美國嘅西岸。咁而家應該係夜晚，但係佢哋 Boxing Day 啊，咁所以呢，就我都唔 expect 佢真係會 join in 我哋呢個live 嘅 Webcast。咁但係唔緊要，今日呢個 topic 呢，我覺得係非常之重要嘅。咁有啲同事會問咩叫 child life 啊咁樣，其實就因為呢個問題呢，我就希望阿 Candy 會上嚟講一講咩叫 child life。咁呢都記得10幾年啦嚇，我哋都好想呢醫院遊戲服務呢就喺香港普及嘅。咁都其實即係我哋不嬲都咁講啦，屢戰就屢敗，咁啊希望屢敗繼續屢戰啦嚇。咁戰鬥啲乜嘢呢？就係其實我哋好希望呢醫管局呢係可以 recognize， 即係醫院遊戲服務 child life 係好重要。咁呢就我諗其中一個原因呢，就係個名呢都係有啲論盡嘅嚇。咁頭先我講呢就醫院遊戲服務啦，咁呢就台灣咧應該2012年嗰陣時咧，佢哋用咗兒童醫療輔導呢個 term 去 describe 呢個 child life service 咁樣樣。咁英國咧就用 hospital play 嘅，咁變咗就好混亂咧。又有啲叫做play therapist， 咁其實樣嘢都好似好 confusing 咁樣。咁我希望呢個 talk 之後咧就Candy 可以透過呢個 talk 咧，令大家明白咩叫 child life。咁我自己覺得咧，就child life 咧係好重要嘅。如果大家睇各大嘅兒童醫院咧，大家都會睇到其實佢哋每一個醫院咧都有呢個 department。咁同埋咧都好重要嘅。咁我覺得我記得有一次咧，我喺 GOS 啦，咁我就想即係揾佢哋嘅 hospital play therapist、hospital play specialist 咧傾下偈咁樣。咁呢啲護士話俾我聽，喂，你唔好阻佢咁耐喎，我哋覺得佢好重要喎。你同佢傾偈咧，我哋啲細路仔咧就影響佢哋嘅 service 喎咁樣。咁如果你喺香港咧，當年喺 USH 嗰陣時，我哋都多謝 CCF 咧，就俾咗一啲child life 嘅 service 我哋，咁咧就啲醫生同埋同事咧，護士同事都覺得，哇，有佢哋同埋冇佢哋咧，啲細路仔表現咧差好遠好遠。咁所以咧就我哋今日就不如嘗試下理解下咩叫 child life， 咩叫兒童醫療輔導，近時咧叫醫院遊戲。咁咧就同呢個 play therapist 咧係完全冇關係嘅。不過咧，我講個笑話啦。我記得即係好多年前咧，有人就問醫管局：喂，你哋會唔會會有啲 child life specialist 或者有啲 hospital play therapy、hospital play specialist 喺醫院度㗎？咁佢哋話：我哋咧就會教啲醫生護士咧就點樣做呢個 service。咁我覺得呢個真係都幾搞笑。其實咧 child life 咧係自己 in its own 咧係一個 profession 嚟嘅，就唔係咧我哋醫生啊、護士啊，咁咧就業餘咁喺度做一啲嘢，咁就叫 child life。咁咧，不如我而家將個時間咧就交俾阿 Candy， 咁咧我就會播呢條片俾大家睇。咁咧就大概有40分鐘。咁如果大家有問題咧，都可以喺嗰個Q&A 嗰度打落去。咁我而家睇下 Candy 會唔會即係都會log in啦，或者咧就佢選擇即時答啦。如果唔得咧，我哋咧就會喺 YouTube Live 喺 YouTube 個 description 嗰度將嗰啲題目咧同埋 Candy 嘅答案咧記錄咗喺度。咁咧，不如我哋睇一條片先嚇。咁我轉一轉個畫面先。
兒童醫療輔導師係受過訓練嘅專業人士， 善於幫助兒童同埋佢哋嘅家庭度過生命中嘅難關。佢哋了解兒童成長發展同埋家庭互動模式，透過遊戲、預習、教育同埋自我表達等等嘅活動，去促進兒童嘅抗逆能力。尤其係喺面對醫療或者入院嘅情況時候，等孩子仍然可以愉快咁樣成長。由於兒童醫療輔導師明白家庭嘅支持對於兒童心理健康嘅重要，佢哋會為家長、兄弟姊妹同埋其他嘅家庭成員提供資訊、支援同埋引導。佢哋亦都會教育照顧者、行政人員同埋普羅大眾，等佢哋更加認識兒童喺壓力之下有啲乜嘢嘅需要。兒童醫療輔導師嘅工作係協助孩子去應付治療時嘅各種挑戰。大人成日都會好驚訝，孩子可以勇敢咁面對痛楚，克服恐懼。而我哋嘅工作能夠達到成果，力量往往就係嚟自孩子本身。我哋願意相信孩子，先至可以幫助孩子揾到佢自身嘅力量。而當孩子能夠相信自己，就再冇解決唔到嘅困難啦。
Hello, everyone. My name is Candy, and my pronoun is she and hers. I am the president of the Hong Kong Child Life Association. In our lecture today, there are a few learning objectives that I would like to achieve. One is having the audience understand what is child life service, and also the history of child life, the value of child life, and the role of child life specialists in the multidisciplinary team. And where else could child life actually practice? So I'm going to jump right in and talk about the history of child life. In the 50s, there's a growing concern about the psychosocial needs of hospitalized children. Play-based support programs, personnel trainings, and research projects had been developed. And in 1962, the term child life first appeared in a report about the needs of hospitalized children in the US. In the following decades, child life had been developed into a professional allied health discipline in response to the psychosocial needs of children in the hospitals and helping sick kids cope with stress brought by their illnesses and their treatments. So apart from the term child life, there is actually also this discipline called hospital play. Hospital play was the title that's used in the UK. Child life and hospital play are pretty similar. They function in pretty similar rationale, but then it have been developed into two independent disciplines based on the different training requirement and clinical standards. There are a well-developed model and training framework for child life in the US, Canada, and Australia. Certified child life specialists as the most widely accepted professional credential, with over 5,000 certified child life specialists over the world. Whereas in UK or New Zealand, their profession is called hospital play specialist or health play specialist. And let's zoom in and talk a little bit about the child life / hospital play development in Hong Kong. So hospital plays was started in hospitals in Hong Kong in the early 90s by two different NGOs. One thing to note is that child life or hospital service in Hong Kong is different than how it would be in the UK or in the US. So in UK or US, child life specialists or hospital play specialists are part of the hospital team. So they're actually hired by hospital. Whereas in Hong Kong, we are hired by NGOs, and then it's the NGOs sending hospital play specialists or child life specialists into the hospital to do the work. One of the NGOs then chose to follow the US model, which is the child life specialist model, whereas the other one chose the UK model, the hospital play specialist model. And the one that actually chose to go with the UK model, they also developed a localized training program in Hong Kong. The first certified child life specialist in Hong Kong was sent by their work to overseas to obtain this credential, and she completed her credential in 2010. Since then, there are more and more certified child life specialists finish the credential process. And we also have individuals like myself who actually joined the discipline after finishing our studies abroad. The first child life program in Hong Kong was started or named, no, I shouldn't say started, I should say rebrand and renamed as Child Life in the 2015. Now, because I am a child life specialist myself, so for the sake of my presentation today, I'm going to focus more talking about a child life specialist instead of bouncing off from child life and hospital play, just to kind of make it a little bit easier for our viewer. So the value of child life is that we believe coping with illness, injury, and treatments is often challenging and stressful for children, adolescents, and their families. So child life specialists provide therapeutic play, preparation for procedure, and education that can reduce fear, anxiety, pain, and suffering for parents and patients and their family. Study shows that child life service result in cost saving, including reduced length of stay, decrease of sedation needs, and improved family satisfaction and rating of their over experience. Here, I'm going to talk a little bit about what is asked of someone who want to become a certified child life specialist. What is the training involved? So first of all, the person would have to at least have a bachelor degree, but on top, they also have to do specific child life training. So they need to either complete this training in accredited program, accredited institution with, say, a bachelor or even a master in child life, or if they come with a bachelor degree or master degree in related field, then they have to complete the following 10 college or university level courses that involve child life course taught by CCLS, 2 child development course that cover age from birth all the way to 18, the family system course, and 1 play course, 1 loss, bereavement, or death and dying course, a research course, and also 3 other kind of electives and related content. Apart from these educational requirements, there is also a requirement for internship. So internship hours is at least 480 hours minimum, but a lot of sites are actually now requiring up to 600 hours. And last but not least, there is also a certifying exam that we need to complete and pass in order to be a CCLS. So let's talk about where do we work. Traditionally, we work in hospitals, we work in clinics, so very closely in the medical setting. And because of that, I want you to think about what comes to mind when you think of being hospitalized. In fact, our association went ahead and asked a bunch of kids and their family. In this video, we covered children aged 7 months to, I think, 13 of age, and their family member to talk about what might be some of the first 3 things that pop up in their mind when they think about having to be hospitalized. So let's take a look.
我會唔開心，因為可能得我自己一個人。我會好驚，因為唔知醫生會做啲咩。留喺醫院好悶。我第一個感覺呢，就係好驚會打針啦。我第二個感覺就係好驚痛啦。第三嘅感覺，我覺得我會好掛住家庭咯。如果家庭唔喺度。想快啲好返。
仲有呢？
求上帝唔想嘔。
仲有呢？最後一個。
想爸爸攬我。
第一樣嘢就會諗，可唔可以陪佢啦？因為佢一個人嘅話一定好驚又好悶啦。 第二樣嘢就係諗就算可以陪佢，咁通常都係得一個人可以陪佢，咁就要一個人湊佢，可能係幾日甚至成個禮拜嘅時候，就可能會好攰，好大壓力，又唔夠休息啦。第三樣嘢就會諗，好彩有買保險咯。
我諗我第一時間應該係會覺得好驚訝，點解要入醫院啦，同埋會好擔心究竟個身體係咪出現咗啲咩問題，或者有咩事無端端要去醫院啦，同埋都會好緊張啦，因為去醫院通常都係一係就探病，一係就係去睇醫生㗎啦，咁所以就會好緊張自己身體係咪出現咗啲乜嘢問題，或者因為醫院呢個環境都係比較壓迫咁樣啦，咁所以都會好緊張。
我如果入咗醫院嘅話，第一個反應應該係會有啲擔心啦，因為如果自己要入醫院，真係可能自己有啲病得有啲嚴重啦。咁但係可能都會有啲興奮，因為唔知道之後會有啲咩，可能有咩特別嘅新嘅體驗啦。最後我可能會有啲掛住屋企人啦，因為要去醫院。
我會覺得好驚，因為驚整親我自己，同埋好痛。然之後第二個呢，就係可能入完醫院後會對你個身體仲好啲呢。咁第三樣嘢呢，就係可能會有家人同埋朋友喺側邊支持同埋安慰我，咁就唔會咁驚咯。
可能冇咁都會放心啲嘅，因為有醫護人員看住，有咩病情嘅改變嘅時候啊，咁都可以有即時嘅照顧啦、照料啦。咁都會擔心嘅就係因為佢哋都可能喺醫院裏邊一個新嘅環境，佢唔熟習。如果真係要揾屋企人陪嘅時候，佢哋又揾唔到，咁或者我哋亦都唔能夠即時去回應到見到佢哋嘅時候咧，咁都驚佢哋會好手足無措啊，唔知點算咁樣樣。咁亦都會可能返到屋企嘅時候，都會有囉囉攣啦。因為平時見到佢哋屋企啊，又或者係一齊生活啊，咁佢入咗醫院嘅時候，你好硬係覺得有一啲日常嘅嘢都因為咁樣而改變咗咯。
As you can see from the video, depending on the age and developmental stage of the patient, their worries really varies, right? Some might actually be more worried about separating from family. Some are worried about pain. Some are worried about their own health, right? And that is all part of in the training. I mentioned earlier about having to study about child development, understanding how children conceptualize this thing called hospitalization or sickness in general. Next, I actually want to share a little bit about how it might be for children coming into a hospital environment. So I have a little clip to a voice clip that I want to share with you. Imagine you are, say, 6 years old, and you have to go to treatment room and get your lumbar puncture done, okay? It might be the first time, it might be the 15th time. But for the sake of this imagination, just say this is the first time you have to come in and get lumbar puncture done. And imagine laying in bed in the treatment room and have your parents kind of stand out and outside of the room, and then you hear the following.
唔好喊啦！你仲喊？我叫你唔好喐啊！收聲啦！好大高隻咗啦，唔使喊，唔好喐，唔准喐啊！咁之後咧就右手咧就再係唔好喐，再喊我叫我走噶啦。咁之後咧左手咧係准喊，係唔使喊，冇事。我叫你唔好喐啊！好大高隻咗㗎，hold住唔好喐，係收聲啊！之後咧就右腳咧就再係唔好喐，唔准喐啊！左手咧係兩下先，係你再喊我叫婆婆走噶啦。
So obviously that's an overdramatic voice audio that I created. But you can imagine if you're in the treatment room and having all these kind-hearted people, staff, telling you different instructions. Some might be saying, hey, don't move, just hold still. Some might be saying, hey, stop crying now, otherwise I'm going to send your grandparents out of the door. Some might be saying, like, you need to, like, lift up your leg or give me your finger. Let me wrap that, equipment around your finger and whatnot. It can indeed get very overwhelmed. So what is our role as child life specialists being in moments like this? So for us, being part of the multidisciplinary team, we're not trying to say, our job is any better than any, other professionals. Indeed, we work together as a team. So our role as child life, because we understand child development, some of the things that we would do in regard to procedure support, both before procedure, during procedure in the treatment room with the kids, and after procedure. It might include using sensory diversion. So for some kids, it might be during that time that they're in treatment room, getting ready, having that equipment set up to them. Then we might use bubbles. Sometimes I might sing to the kids and just say, hey, I know there's a lot of sounds going on. Focus on my voice. I'm going to sing your favorite nursery rhyme to you. I'm going to sing ABC to you. Or, I might just say, I know you're really worried about this cold you're feeling on, say, the treatment bed, right? It's cold. So why don't you hold on to my hand and feel the warmth of my hand? So based on their need, it's a very individualistic thing with the patient that we might use sensory diversion. We might also help family to help cooperate by holding the child in comfortable position. Say if a children needs to get blood drawn, and sometimes maybe the fear is not so much about the blood drawn, it's more worried about mom and dad not being here. Mom and dad got sent out from, outside of the treatment room. Then we can actually help the family to learn how they can actually hold on to their kid in this thing called comforting position, and also anchoring their arm if that's where blood needs to be drawn, so that medical professional can indeed get blood much easier without the kids fearing about, oh my gosh, mom and dad's not here. We can also help with relaxation. So sometimes kids might have done the same procedure multiple times, but there's still a lot of stress. There's still a lot of anxiety. Some kids, even if sedation is involved, so some kids actually get really worried once they got sedation, but that very split film moment between getting the sedation and being fully sedated. For some kids, those are moments that they're really freaked out about. So those are times that maybe we can be next to the kid. Again, just notice my voice. I'm going to count for you. Just hear my voice. Or we can remind them certain like relaxation techniques that we have practiced prior to procedure. Breathe in. 3, 4. Breathe out. 2, 3, 4. Things like that to help with relaxation. We can also provide emotional support. And in here, I also put down this note that says utilizing one voice. So in the earlier audio clip that you listened to, it's all really important instructions for the kids to follow. However, when people are talking over one another, it can get overwhelmed. Even everyone is saying, everyone's goal is the same, trying to help the kids to relax, trying to get the procedure done. However, if we're not aware that multiple voices, multiple instruction can indeed overwhelm a person. So it might also be a child life's role to remind everybody, hey, let's just take a pause. Let's have us speak one person at a time, so that the kid can actually have enough time to process what we ask them, what we ask them to do and follow. Apart from procedure support, we also provide a psychosocial aspect of support to the family and the children. We normalize hospitalization. So by helping to process, some of the difficulties by being hospitalized, and also how we can cope, what the kids have achieved. So we might do that by using bravery beads, for example, which is, say, we use different beads to build a necklace, and each bead might actually be symbolizing different procedures, like from check-in, from taking blood pressure. So it's a way to help a child kind of conceptualize different procedure supports, or different procedures or different aspect of hospitalization, and then they can have this very concrete, tangible thing, which is the bracelet, to tell the story. Oh yeah, I remember I successfully got my blood pressure taken, and I wasn't really scared. And I know during that time, it's just like a big squeeze on my arm. It's not something that I have to freak out too much, right? So it's giving them ways like this to conceptualize what is happening. Minimize sick row. So this is a support for children, but also for family. A lot of times when family think about, oh, my kid's sick, they need to just rest. I better not give them too much toy to play or too much screen time. They just need to rest. Or especially, with the younger side of children, sometimes parents are getting scared of playing with them because of now all these different equipments that's hooked up to them. So it would also be a child life specialist role to provide toys, educate the parents how to continue to play with the kids, because play is how kids learn. Play is also how kids process what's going on. And by doing all that, or even encouraging, hey, say in NICU situation, we're talking about really small preemie, how in normal situation we encourage skin to skin, but in preemie, maybe sometimes it's not as easy to do skin to skin because of all this equipment. So we can encourage family to give them a hand hug, give baby a hand hug, which is putting one hand on the tooth of the baby and then the other hand on the head of the baby, still giving that sense of containment and safety in a way to normalize and, the parents, children bonding and minimizing sick row. There are still a lot of things we can do apart from just being sick. Child life specialists might also provide a respite service for caregiver, especially in chronic illness situation. It's indeed a lot for caregivers to stay, if they can stay, depending on the hospital, but to be there 24/7 with their sick child, especially in some cases they might still have siblings outside, at their home, or they still have their work. So we can provide that 2 hours of Mom, go for a walk, just process what's happening, go for a walk, do your little self-care, go get a cup of tea, whatever that might be. We will keep the kids company. We also provide support to siblings, helping them to understand why mom or dad are not, and say, my older brother or younger sister are not home as much anymore. What's going on? Why is my brother looking different now? Did I cause this? Again, a lot of children, depending on the age, they have this tendency of internalizing any hardship, thinking that maybe it's because they did something, right? So that's when we come in and provide education, provide support, and clear out any misunderstanding, and also to educate what is whatever disease that your brother or your sister is going through. The same thing, we would also go to schools and talk to the classmates, obviously with the consent of the patient and the family, to educate the peers. What is leukemia? What is this thing called bone cancer, for example? And what is your classmates actually going through? How can we support them when they come back to school? What might be some of the things that might look a little different? But different doesn't mean it has to be scary. So we also believe that, education and giving age-appropriate knowledge to children in general, whether that be the patient, the siblings, or their peers, it's a way to really empowering them to cope with this difficult situation called disease in general. So next, I would like to share a little video of how might that look like. I know I've talked a lot and it's all just like concepts right now. So I got this little video that I've done with actually American Dance Therapy Association, because I'm also a dance therapist, talk about my work as a child life specialist and dance therapist in the hospital setting. What is my role in this multidisciplinary team? How do I fit in? What kind of puzzle do I play in order to support our patients and their family?
Imagine walking into the pediatric hematology oncology unit of a hospital. You open the door of the isolation room and you see Jenny, a 9-year-old with developmental delay and a huge tumor on her eye. She's new to the unit. She normally gets her procedure done in the outpatient. However, the tumor is starting to grow and would start to bleed tremendously. That's why she needs a little bit more intensive care right now. I walked in the room, wanting to introduce dance movement therapy and child life service to her and her family. As I opened the door, Jenny stopped what she was doing, and she looked at me. And she held her breath, and every muscle in her body started to tense up. I took a step towards Mother, trying to say hello and ask for permission to talk to Jenny. As I took that step, Jenny started screaming and kicking and throwing her body all over the place. Mom's starting to worry that Jenny's tumor is starting to bleed, and she was about to ask me to leave. And right at that moment, I started tapping on my laps. I get scared when new people walked in, and I don't like it. Jenny stopped screaming. She looked at me. Her body relaxed a little bit. I go back and go, I get scared when new people walked in, and I don't like it. As I walk a little bit closer and closer to Jenny, Jenny kept looking at me, and from her look, I knew that I've got her permission to stay. Right now, I'm right by her bedside. I took up an iPad with a sing-song app, and we extended our movement from tapping on our body to tapping on an iPad. Now, we're laughing, we're singing, and we're dancing. Mom looked at us with a huge relief and surprise, saying that, it's the first time you laughed since you got admitted. By tuning to Jenny's body, I reflected back to her in a rhythmic pattern. It gives me a way to get into Jenny's world. And it's very important because that's actually verbalizing what Jenny's going through and making sense out of the situation for her and people around her. One of the things that Jenny has to go through almost every other day is getting her dressing changed for the tumor. And it's always a very, very difficult time because she would get so nervous and it hurts. The medical staff didn't know what to do, how to get her cooperate, so they would have to give her sedation. However, every time when the sedation is starting to wear off, Jenny would be so nervous and she would start kicking or trying to get up, which actually caused more bleeding. And Mom told me one time They actually had to give her 4 doses of sedation in one dressing change. In order to help Jenny and I co-created this dance together. A dance of being still, being calm, and then we end the dance by thanking the medical staffs. I was able to catch Jenny's dressing change a couple of times, and whenever I'm in there and I see her being in this awake and not awake state, I'll start doing our dance. A dance of being still, being calm, and thanking the medical staff. When we do that, Jenny only needed 1 or 2 doses of sedation. Our work together has helped Jenny to gain mastery in this hospitalization, has helped Mom to get a little bit more relief out of this pain seeing her daughter suffer. It had also helped the medical staff, giving them a way to have Jenny cooperate and have him working as a team. It's an honor and privilege to be able to work with this family and know that my work as a dance movement therapist is making this unbearable experience just a little bit more bearable.
So before I end this lecture, I would like to take some time to also lead us into, we focus a lot on the medical setting, like in hospital, in clinic, but where else can child life specialists work? In fact, the work environment has really expanded tremendously, I would say, in the past 5 to 8 years. Certified child life specialists no longer just work in the hospital and clinic, but we would also work in like camps, foster care agencies, jurisdiction system, funeral homes, helping children to process about death and dying, hospice and bereavement center, or even museums. Some museums and education center are now actually hiring certified child life specialists to think of a more interactive way to engage, a more immersive way to engage, museum goer to understand and interact with the art or whatever that might be. In fact, here I got a quote from a child life specialist, Kathleen McHugh. She said, maybe the things that define our scope of practice are neither specific service, nor are they locations or populations or service provision. Rather, what makes a child life unique is the philosophical focus within which most of our practice occurs. Child life is primarily preventive, proactive, and health enhancing. On a day-to-day basis, much of what we do is assess possible high stress or development threatening situations and provide children and families with tools to manage and cope with the challenges inherent in these difficult situations or these difficult experiences. And that brings to the last piece of my lecture today. In fact, I would like to share one more story with you to kind of model or show you how work of child life specialists could also happen in a more community sense. So I'm going to share a clip with you, which is one that I prepare my own child for a COVID test in the middle of COVID time, right? And then I posted this video on social media, on internet, in order to help other family to also prepare the children to go through PCP. Thank you for your time. Take care.
In light of the Omicron situation, more and more children are in need to do COVID testing. So I would like to share with you how I prepare my child as a mother and also as a certified child life specialist to go through her PCR. All right, Shani. Hi.
Yeah, I know, it's 多多。我哋咧一陣間又要做檢查喎，知唔知啊？咁係啦，我哋攞呢一個會擺喺個鼻哥嗰度轉，之後拎翻出嚟。未得喎，仲要等多陣喎，仲有另一邊。擺個鼻哥度轉，拎翻出嚟，咁就搞掂啦。爸爸媽媽會攬住你，你自己試下。係啦，擺多多個鼻哥嗰度，鼻哥喺呢度。轉，yeah， 拎出嚟，呢邊咧鼻哥擺落去，轉，拎翻出嚟。咁之後咧，我哋要將呢一個 sample 咧拎走去做檢查。I know， 多多咧可能會唔舒服喎，多多會咁我哋點算啊？我哋攬多多。You wanna try it again？ 呢度嗱，你自己拎住，你幫多多做檢查，係啦，喺個鼻哥嗰度。
All right, we did that with Toto. We're just gonna put that on your nose.
I know, BB. I know. Oh, wow.
I know.
Wow, BB, you did a really good job.
We need to be
Wow.
still. Yay!
Good job, BB. Wow.
Like a
I know. Good job.
trooper.
I know. It sucks. I know. Wow.
Almost. Yay!
Awesome. My first
So
rodeo.
we need to be really still. I know it's not comfortable.
There you go.
Ooh, there it. Okay, do you want me to do the other side with the same one?
Yeah.
Okay. There we go. Thank you.
I know. It's tickly.
It's tickly, right? But you did
tickly.
so well for being
did a good
so
job.
still. Thank you.
I'm done.
All done.
Itchy nose.
好，咁咧就非常之多謝阿 Candy 俾咗呢個好精彩嘅 talk。咁咧就最後尾個 video 我睇過好多次，我每次睇都好開心，見到個小朋友其實咧唔係淨係一個 video 嘅，咁即係我都有一個機會咧，就好近距離同佢哋一齊工作啦。咁頭先其實佢講有兩個NGO 喺香港咧都 provide child life service。咁我最先接觸嘅就係 CCF 啦。其實據我所知 ，CCF 應該喺香港係第一個機構俾 child life 嘅，child life service 嘅。咁跟住我有機會喺 Playwright 啦，咁又即係同啲同事一齊做。咁咧我成日覺得咧就係好簡單嘅啫，即係個世界你覺得有冇用咧？最緊要問嗰個小朋友。咁咧我有一個故事咧，有一次咧就Donald David Look 就做完啲 laser， 咁一個好細嘅小朋友3歲啊，應該係3歲。咁咧佢就坐喺個 recovery room 嗰度，咁其實係一個即係 play room 嚟嘅啫。咁我就走埋去同佢傾偈啦。我話妹妹啊，下次你仲嚟唔嚟啊？咁我都未講完啫，佢就話嚟咁樣。咁我就知道咧，我哋好成功啦。咁當然就唔係靠我哋啲 sedation 啊。通常你知 sedation 完啲小朋友好扭計啊，好 disturb 啊咁樣。但係咧就呢個小朋友就係啲 child life specialist 幫佢。咁佢嘅反應咧，我覺得好開心，因為做 laser therapy 有時要成起碼都8次。咁如果第一次嚇怕佢咧，第二次佢又唔嚟。去到秀茂坪佢已經唔嚟。咁所以咧就嗰次咧係我最深刻印象。咁其實跟住咧，我哋見過好多事例咧，就啲小朋友其實比大人更加之叻啊！即係佢哋 cope with pain 啊 ，cope with stress 啊，cope with fear， 咁咧更加之叻。咁所以咧，我覺得 child life specialist 佢哋真係好有本事。咁其中另外一樣嘢咧，就佢哋好少講嘅。 咁咧我就有一個感覺嘅，我就話其實咧父母咧好多時都唔知自己嘅小朋友咁叻嘅，咁但係佢要好保護佢啊嘛，即係佢覺得哇佢好慘啊，咁所以做好多嘢 protect 佢，咁有時咧就 over protect。咁我自己有 theory， 我就話其實會唔會啲小朋友咧，因為我哋太過 over protect 佢咧，就變咗個個都講女講男咁講即係啲講鞋咁樣，即係會唔會咁咧？其實咪因為我哋唔識教啲細路仔去即係 cope with 個 stresses 咧咁樣。咁好啦，咁即係其實都希望 Child Life 喺香港可以慢慢變咗一個即係 regular 嘅 service。我頭先啱啱睇翻啲web pages 咧，咁其實喺台灣佢哋已經即係有啲Child Life specialist 啊，佢哋係一個好 regular 嘅服務。咁我都有機會喺台北即係講嗰堂書啦。咁其實佢哋好重視嘅，佢哋即係啲 government official。都會嚟聽啊，咁同埋佢哋有 support 嘅。咁但係香港就好困難啦。咁我記得都好耐啦，都2010幾年嗰時，10幾年之前咧，當時我諗仲係 COC 個年代，我就即係 propose 俾 HA 啦。咁個反應就好有趣啦，就話我哋都唔會 provide 呢個 service 噶啦。咁不如我哋 train 啲醫生啊、護士去做呢樣嘢啦，咁樣。咁其實我覺得唔得嘅，因為點解啲細路仔唔係蠢噶嘛？你呢分鐘同佢玩，下一分鐘督佢，咁其實即係 work 唔 work 咧？咁況且根本 child life specialist 係要一啲training 啊，同埋最緊要佢哋有耐性，同埋有個方法去做。咁卒之都係即係冇啦嚇，到而家都係冇啦。咁第三樣咧，我覺得好慘嘅咧就係。唔知 somehow 咧 HA 有一個諗法，佢就話呢啲唔係我哋 HA 嘅 staff 咧，我哋就叫做 volunteers。咁 volunteers 咧即係可有可無啦嚇。咁有時疫情嗰陣時就for whatever reason 就閂咗個 ward 啦。咁佢哋入唔到去啦咁樣。咁佢哋基本上平時 access 唔到個 ward 啦，即係我喺啲兒童醫院我睇得到。咁就我覺得呢樣嘢唔 work 嘅。咁嗰時我有個 counter argument 嘅，我就話。咦，你會唔會將紅十字會啲老師都當佢 volunteers 咧？咁當然唔會啦。咁即係第一，佢哋就話呢個因為有 compulsory education for 啲細路仔，咁佢哋唔係 volunteers 嚟嘅。咁第二當然，即係當年就係特首夫人做呢個 patron 嘅嚇，咁所以咧就即係我諗 politically 佢哋又唔會將呢個紅十字會老師做 volunteers。咁其實我係覺得即係呢個已經即係反映到即係HA 對Child Life 咧其實係毫無認識嘅。咁所以咧就我點解好希望 Candy 會講呢條片，我擺上 YouTube 度，希望呢個係一個 record。咁其實我另外一個原因咧，我就希望即係我俾我啲 medical student 會睇，因為我覺得即係由佢哋開始啦，希望佢哋即係知道 Child Life 有幾有用啊咁樣。咁呢兩個機構其實我覺得都盡咗好大努力㗎啦。譬如 CCF 咁樣，當年 USH 咧就都冇 cancer patient， 咁嗰陣時 Alistair 就俾一啲non-cancer patient 咧都有 child life 嘅服務。咁in return 我哋又幫手 train 佢哋啲同事啦，一齊學習。咁我記得嗰時係 Phoebe 同 Karen， 咁Phoebe 離開咗啦，child life 啦。service 咁Karen 咧最近我聽到佢就喺加拿大做翻 child life specialist， 咁幾好。咁第二個機構就playwright 啦。咁但係 playwright 咧又唔係全部睇hospital play 嘅，即係佢有好多譬如 playground 啊，好多其他 service 佢要兼顧。咁所以我就覺得即係兩個都有啲局限嘅。咁呢個第一個，咁第二個佢哋係 volunteers 啦。第三個我都唔知啲funding佢哋即係會點樣，尤其是喺而家啲咁嘅經濟環境嗰度。好啦，咁但係你話有冇人想做hospital play specialist 或者正確啲講呢個 child life specialist 咧？又其實好多人想問喎，我想做醫院遊戲咁樣。咁今日 Candy 呢個 talk 咧就講咗個 framework 啦，即係點樣 train。咁但係我覺得呢個係好 basic 嘅啫。 咁我同playwright 佢哋咧就我 offer 咗一個 opportunity 就係話佢啲同事咧不如咧每一個月度啦都會 present 啲 cases， 即係我喺度啦，咁我就俾個 medical input， 即係嗰啲係咩病嚟㗎？個 treatment 係點樣㗎？咁因為我覺得就咁頭先你大家睇個 child life specialist 嘅 training， 其實佢哋都要有啲 domain knowledge 嘅。咁我想當年即係阿 Phoebe、阿 Karen 同我哋一齊合作嗰陣時，其實我哋會 join 埋我哋啲 rounds 啊 ，join 埋啲 case conference 啊。咁佢哋就一路做一路學。咁所以咧就我好希望即係將來咧而家都有嘅，我估有啲醫院即係都有啲醫院遊戲師，即係唔係叫醫院遊戲師，叫兒童醫療輔導師。咁咧，如果喺你個嘅 department 嗰度做嘢咧，麻煩大家都俾一啲時間同我哋傾下偈，俾一啲 medical knowledge 佢哋，等佢哋有多啲 domain knowledge。咁同埋咧，我好鼓勵，希望你將來會多啲 case conference 啊，俾佢 join 你 rounds 啊咁樣。咁當年我喺 UCH 嗰陣時咧，就我都好大膽嘅，我就話我個 terms 叫 embedment， 即係我希望啲 child life specialist embed 咗個 unit 嗰度。咁第一咧就佢哋唔着翻 CCF 啲衫嘅，佢着翻 UCH 嘅衫嘅。咁咧變咗等啲staff 啊同埋啲 family 都覺得佢哋我哋一份子嚟嘅。第一，第二咧，我俾佢哋睇我哋啲 medical record， 同埋佢哋可以寫落個 medical record， 即係後尾有 CMS 啦，佢哋可以打入去嘅。咁變咗咧就我哋 work as a team 啦。咁我覺得咁樣咧就即係對成個 child life service 嘅發展咧就非常之有用。咁就我好希望即係而家我就覺得困難嘅，因為有好多人就走咗啦，經濟又唔好啦。咁但係我都信樣嘢都係個 cycle 嘅，咁有低谷亦都會有即係高峰嘅。咁我希望如果我哋而家做定呢啲 groundwork， 到將來嘅個社會資源好啲嗰陣時，或者啲人精明啲、開明啲嘅時候咧，又會將呢樣嘢帶翻出嚟。咁但係我諗都要朝着幾樣嘢啦，即係第一，我哋要明白 child life 係有用嘅。第二，我哋要明白 child life 咧，其實係一個 profession 嚟嘅。咁一個 professional 咧，一個 profession 咧，第一佢哋要有自己嘅quality assurance 啦，即係自己會自己進步。第二咧，佢有 continual education。咁第三，佢有 audit， 同埋咧佢要有 research。咁其實我都即係同啲有心嘅人都做咗好多嘢，不過即係奈何都唔係好成功啦。我記得1-2年前我哋請咗 CCLS Council of Child Life Specialists 嚟香港，咁就希望即係有個諗法，就係頭先提過480至600個鐘頭嘅 internship。咁我哋傾緊會唔會即係呢啲 internship 咧可以喺香港嗰度做咧？一路做嗰陣時其實 benefit 到我哋細路仔咧咁樣樣。咁我後尾冇 follow up 啦，因為我都後尾都離開埋呢個playwright。咁就我今日呢個 talk 就係希望再 revisit 呢個 topic 啦，又希望出邊好多有心人。今日咧我睇到個 list 咧，其實好多護士參加。咁我希望即係你哋會即係pick up 翻呢樣嘢，因為我覺得 child life service 咧對個細路仔好有用，幫到佢哋自己用自己嘅方法 cope with 個 stress 同埋 fear， 亦都幫到個父母知道個細路仔咧其實佢哋有能力去 cope with 個 fear 同埋即係 stress。咁第三咧就係其實我覺得即係喺兒科服務咧 child life 咧係一個非常非常非常之重要嘅 component 嚟嘅。咁香港做唔到啲咩兒科嘅 centre of excellence unless 你有child life 嘅 involvement。咁最後尾我就有一個即係有一個願望啦，我就係話希望每一個細路仔喺醫院裏邊如果佢需要 child life 服務咧我哋都俾到佢。咁唔係喺1-2間醫院度，唔係淨喺兒童醫院嗰度，係要喺每一間醫院。 如果個細路仔入醫院，佢係要child life service 咧，其實我哋都希望俾到佢。咁當然頭先 Candy 最後尾個 slide 就話，其實唔係淨止醫院㗎，其他好多地方都會有用嘅。咁呢個再遠一步啦，咁樣。咁聖誕節通常都係充滿希望嘅，咁我希望呢個 talk 都帶俾我哋希望，將來咧就會有一啲service 咧俾到我哋啲小朋友。咁網上第一個問題而家答唔到嘅，咁因為應該我諗 Candy 今日都未必得閒，咁佢就話 May I know how child life helps sibling and cousins to cope with the sudden loss of a child in the family? It's too painful and too real, but it's happening. 呢個真係嘅。咁即係我哋都經歷好多啦，即係我哋做 ICU 或者做 pediatrics 都有啲小朋友即係過身，其實父母都好難 cope 啦，何況啲小朋友。咁child life 佢哋頭先你睇個 training 係有嘅，其中一樣佢哋要讀嘅就係 bereavement。咁當然我哋一齊學啦，即係生死教育咧，其實係唔係話讀完書就識嘅，我哋都要一啲經驗。咁希望但我睇下 Candy 遲啲會唔會喺網上答翻。咁跟住呢個同事就話 I wish to make a comment. Thank you, Dr. Chan, for offering medical input to the play therapist. 唔係 play therapist 啊，佢哋叫 child life specialist. The concept of embedment and case conference is really great. Hope this will thrive in different parts of the world, of Hong Kong and elsewhere. Like the rainbow card for NLP becoming the standard in childcare。好多謝呢個同事啊，因為我都唔係好記得呢個 rainbow card，原來係啊，我都係我嗰陣時做。Where there is no regular child life service in UK, Hong Kong, are there any website that parents and family can at least look at and take some reference from？ 咁就如果大家上網睇好多嘅，即係 child life 嘅服務，其實係非常非常之多嘅。咁就我今日即係希望可以喚起呢一樣嘢，即係俾大家留意下medical service 嘅 advancement 咧，唔係淨係我哋啲 science 嗰啲嘅，其實 art 都好緊要 ，empathy 都好緊要啊。咁involve 個小朋友 ，involve 個 family 都好重要。咁我好希望即係呢一個 talk serve 到個 purpose 啦。第一就我好希望將來 medical student 或者 nursing student 會知道有一樣嘢叫 child life specialist、child life service。第二，我希望即係我哋醫護人員都幫一幫佢哋 develop， 因為淨係靠佢哋咧，我諗係唔夠嘅。即係我哋要 work as a team， 俾多啲 input 佢哋。咁希望即係佢哋會慢慢成為一個 profession。我希望有生之年見到佢哋喺香港咧係一個 profession。Meanwhile， 我希望大家即係繼續支持嗰兩個NGOs 啦，即係 CCF 同埋Playwright。另外仲有一個 comment， 我十分同意20年前已經運用過幽默治療、遊戲治療，喺臨終病房可以幫病人舒緩精神緊張，幫孩子去探訪，兩個人陪伴在側咁樣。咁我都好鼓舞嚇，即係好多同事都share 佢哋覺得 child life 係有用。咁唔好諗住即係兒童醫院成立咗就即係樣嘢會有，係冇嘅。咁我希望即係大家都即係有一個好嘅 perspective 去睇成個嘅 development。咁咧今日就好多謝大家收睇。咁我見到都百幾人睇呢個。呢個仲有一個嚇，睇下 Christy 講咩先。I've heard that medical clowning before. Wonder if it's another specialty like child life。啱嘅，即係小丑醫生其實都有用嘅，即係嗰啲動物都係有用嘅。咁但係我覺得即係最重要就係你有一個系統去點樣睇，即係呢啲唔同嘅方法去點樣幫你小朋友。咁 so far 即係我睇咗咁耐，其實child life 佢哋嘅 training 啊。佢哋嘅 service 咧，其實係最有系統。咁當然你話我成日都同佢哋講，其實我哋有好多方法去做嘅，點樣 relieve 佢哋即係 pain and suffering。譬如好簡單，我見過一個 situation 就係 喺一個窩鬆嗰度嘅。咁有個士兵咧，有個士兵就其實佢識變魔術嘅。咁佢就一路玩魔術，就一路咧個醫護人員咧幫個小朋友咧就包紮呢個傷口啊，咁樣清理呢個傷口。咁原來又得嘅。咁所以即係好多方法嘅。不過我諗要有一個系統啦嚇，有個系統去點樣幫啲小朋友 cope with 個 pain 同埋個 stress 啊咁樣。咁今日都好多謝大家啦。咁聖誕節大家都留喺電腦或者電話旁邊睇呢個節目。咁我今夜啲我會將呢條片擺上去 YouTube 嗰度。咁如果我知道好多朋友都或者離開咗香港啊，或者過節啊咁樣，咁麻煩大家將呢個片大家 share 出去。我好希望 Child Life 咧喺每個幫小朋友做medical service healthcare service 嘅同事咧都知佢嘅重要性。咁我亦都好希望即係將來Child Life Specialist 喺香港咧係一個 profession。而我好希望每一個細路仔，如果佢喺醫院嗰度，佢哋有需要 Child Life Service 咧，佢哋將來都可以得到呢個服務。